Hello, everyone. Today we're going to share with you the results of the study we're presenting at RSNA on synchronous virtual radiology consultations, the preliminary results from a cluster randomized study in primary care patients. And today we're very excited to have the study team with us. My name is Dania Daye. I'm an interventional radiologist at MGH and the PI on this study. We also have Dr. Susan Bennett, who is a primary care physician in the Internal Medicine Associates Clinic at MGH and the lead PCP on the study. And we have Nikhita Nambiar, who is the research assistant on this study. I'll turn it over to Dr. Bennett to discuss the motivation behind the study and how it all started. Dr. Bennett?
My collaboration with our radiologist started over 10 years ago. I was frequently going to the radiology reading room at Mass General to review incidental findings on CT scans that my patients wanted to understand more about. Incidental findings were threatening, they required additional surveillance, and frankly, I had a lot of trouble finding the language to explain to patients what these findings meant and to try to reassure them. I really wasn't able to reassure them most of the time. So we came up with the idea. A couple of the radiologists in the Dodd room at Mass General came up with the idea to embed a radiologist in my practice one morning a week to offer patients an opportunity to review their imaging with a radiologist. This occurred and continued to occur right up until the pandemic when we stopped having our radiology consultation clinic. What I discovered is that patients were extremely reassured. Even the most anxious patients were reassured by reviewing their imaging with radiology staff and also with radiology residents who subsequently were the primary radiologist on site. But what really surprised me is how much patients really were kind of thrilled and excited by viewing the inside of their body as radiologists would sort of scroll through their cross-sectional views of their torso. Patients were just amazed, really amazed and thrilled by being able to see the inside of their body, which of course they should be able to see. The test has been done and it is their body. So I was really kind of stunned by that and thought that perhaps we should make this a regular part of primary care, is allowing patients to see their imaging. So how to do that is what led to this study. So Dania, I'm going to turn this back to you so that you can describe our pilot and subsequently how we came up with the idea to do the study that we're reporting now.
And based on the discussions that we had with primary care was born the Radiology Consultation Clinic. And in its early days, the clinic was in person in the IMA clinic, where we had a radiologist spending half a day every week available to discuss imaging with any patient who was interested based on their PCP agreeing to this consultation. And we got some very good results from this initial experience. And after that, we decided that it's important to find a model to scale the radiology consultation clinic. And with that, we decided to move to a virtual consultation model where radiologists are still sitting in the reading room and able to integrate these consults throughout the day between reading studies. We did a pilot a few years ago that we shared at RSNA, where we had very positive experience and very good results, both from the patient and PCP side. And based on that, we designed this cluster randomized study in patients with atherosclerotic disease that Nikhita will talk about more. Nikhita?
So far, we've enrolled 91 patients in this cluster randomized study, and we had a control and intervention arm. 30 patients were in the intervention arm that completed the post-visit survey, and 25 patients in the control arm completed the survey. And the patients that we included were over 45. They had an appointment with the PCP at our clinic and a recent chest or abdominal CT indicating atherosclerotic disease. And so what we did was we had the patient talk to a radiologist virtually on an iPad during the first 5 minutes of their PCP visit. And some of the endpoints that we measured through the survey were patient satisfaction, patients' understanding of their disease, as well as prescription changes that resulted from the virtual consults.
So based on the study design, we assessed both patient satisfaction and patient understanding of their medical condition, as well as any prescription changes, as Nikhita mentioned. And some of the results that we saw were pretty striking. For example, in the control arm, following the current standard of care, we saw that not a single patient saw any of their radiology images. They just discussed the results. And even of those in the control arm, only 40% discussed radiology results with their PCP based on the survey data that we got. And when we asked about whether a discussion of the radiology results and seeing images improved the patient's understanding of their medical condition, we saw that the intervention arm, 100% of the patients indicated that they had improved understanding of their medical condition based on reviewing the images, while only about 20% of the patients in the control arm indicated that discussing radiology results improved their understanding of their medical condition. One of the very interesting and powerful results that we saw from this study is when we looked at prescription changes for specifically statins and antihypertensives after the discussion with the radiologist and looking at the atherosclerotic changes in the vasculature, we saw that indeed there was actually a higher number of patients in the intervention arm that had prescription changes in these medications compared to those in the control arm, indicating that indeed there might be an effect that is being seen, although I will have to say that the results are still preliminary, and we'll have to see if they pan out as we complete enrollment in this study. So the main conclusion from the study is we see that there is certainly a positive effect on patients' shared decision-making metrics and potential change in changing PCP management decisions. And we hope that the radiology consults have the potential to advance radiology's value in care delivery by providing more personalized radiology care and promoting patient-centered practice models. And with this, I'll turn it over to Dr. Bennett to share with us some tips for successful implementation and future directions. Dr. Bennett?
Once primary care doctors become convinced that this is a means to convey the importance of treatment strategies for hypertension, hyperlipidemia, preventing cognitive decline with aging, I think they will be more inclined to involve radiologists in virtual consultation during office visits. It's hard to ask primary care doctors to do that right now because our visits are only 30 minutes long. And during those visits, we are asked to accomplish a huge amount of activities. But this is so important. And if the effect is to actually improve adherence to strategies to lower cardiovascular risk, cerebrovascular risk, I believe that primary care doctors will be inclined to maybe have visits that are only dedicated to this purpose. Also, I don't think that it necessarily has to occur during a doctor's visit. It could occur in the patient's home. Why couldn't a virtual visit be something that patients could have on their own computer at home, ordered by a primary care doctor who understands the importance of the strategy?